I've had several questions about why do my hands tingle, why am I getting numbness? And this is something that over years in the clinical practice that some people are confused about what can cause this. So I brought my little old Grant's Atlas of Anatomy. It's actually the same one I use in medical school, so it's been around a while. But it's a classic, and it really has the information that you need to kind of examine the upper extremity, let's say. So basically, let's start right off. And we're going to start with, this is the shoulder, here's your neck, and you see these yellow things are the nerves coming out of your neck. So some people, when they have numbness in their hands, it can be from their neck, it can be from a pinched nerve up in this area, and it'll go down your arm and into your hand. So a lot of people will think, well, why does my neck hurt? Well, generally with a pinched nerve, it's not your back or your neck that hurts, it's where the nerve goes. So in this case, it would be down your arm, maybe into your fingers. So example of that would be C6, it'd be like you make a 6, so it looks like a 6. That's what goes numb with a C6 pinched nerve. But basically when you push on the neck in this area, which is up in here, right in here, if you push on here and that's tender, okay, that's a pretty good sign that maybe the numbness or tingling might be coming from your neck, okay? And then we go down the arm, and another thing could be causing it, especially in the 4th and 5th fingers, is your ulnar nerve, and that could be in the elbow here. This is called your crazy bone, is another name for that, all right? So everybody says, oh, I hit my crazy bone. Well, the crazy bone isn't a bone, it's a nerve. And it shows here, this is your elbow looking from the back. This is the inside, there's a little bone here. It's right here, it's called the epicondyle. If you reach, you touch your little bone here and reach inside, there's a little soft spot. That's where the nerve is. If you ding on that, and it goes out, I can feel that in mine. You can feel that in your finger. That's your crazy bone in your nerve. And this shows, this yellow actually shows the nerve here. Okay, so that's what your crazy bone is. And then if we go a little further, this just shows a dissection of the same thing. Then we talk about numbness in your thumb, your first finger, second finger, a little bit of your ring finger. That's generally median nerve or carpal tunnel. Sometimes the way you can tell whether it's from your neck, like C6, or carpal tunnel, is C6 will be this finger, and part of this one from your neck, where the carpal tunnel will have all of this one and part of the 4th finger. And basically this shows your kind of your carpal canal here. And this yellow thing here is your median nerve, and it goes up into your wrist. There's some better diagrams here. And what happens with carpal tunnel is this blue stuff, which basically coats the tendons to keep them gliding, it's called synovium, sometimes will swell up and get inflamed. And then this little band right here is called the flexor retinaculum. It's just a band of hard tissue that kind of keeps the tendons in place, so when you bend your wrist, they don't pop out like a bow and arrow. So what happens is that blue stuff swells up in this part of the hand. You can get away with it because it's not restricted. So this is kind of like a dam that pushes that blue stuff or that synovium down against the tendons in the nerve. Well, the tendons, you'll feel like a little stiff, but there's no pain. If it pushes on the nerve, that's what causes carpal tunnel, numbness and tingling through this part of your hand, and sometimes weakness in the little muscle here. So this shows a little better picture. This is your flexor retinaculum. That's that band of tissue. The yellow is the nerve. The nerve goes underneath and out into your thumb, this finger, and part of this finger, okay? So what happens is, if this gets all inflamed underneath there, there's nowhere for the nerve to go. The nerve gets pressed, starts yelling for help because it's being pushed on, causing numbness and tingling. So you can do an injection by putting low cortisone in the canal here, which reduces the swelling in that blue stuff, the synovium. That helps. You can do a local cock-up wrist support to kind of hold your wrist back, which gives you more room through the nerve, especially at night, because a lot of people sleep with their hand bent. When this happens, it puts more pressure on the nerve, and you wake up with your hand numb, having to kind of shake it. So that could be an indicator of carpal tunnel. But the surgery, all you do is release this band right here. You go ahead and make a little incision, and whoop, just release that, opens that up, takes the pressure off the nerve, and a lot of people get almost immediate relief. And this just shows you some more photographs of the nerves coming out of your neck. And this is a good picture of it here. This is a triangle here. This is basically where the nerves come out through your neck. And this is kind of a schematic, and you can see where like C5, C6, C7, you know, the different levels in your neck, how the nerves all come out and they form what's called the brachial plexus, and that goes down your arm. And you hear in football, like a guy has a stinger. I get off subject here, but it made me think of something. A stinger is when your head gets pulled away or your shoulder gets depressed. Let's say a player hits his shoulder down, as Nick goes this way, what happens, these nerves get stretched. And that's all a stinger or burner is. Some are bad, some are not so bad, so you assess them to see if there's any weakness from these nerves, and if the pain goes away, you can send them back in. If not, then they have to be treated. But anyhow, that's just kind of some simple thoughts on my end in terms of what I look at when I'm examining the upper extremity for a complaint of numbness or tingling in your fingers.